just connecting to Maryam. There she is. Hi, Maryam.
Hi, Jesse.
All right. So good to have you here. Thank you for joining us.
Thank you for having me.
Okay, so our talk today, we're going to discuss the pandemic that we've all been globally going through. And we're going to discuss trauma and recovery as well. So just as an introduction, I want to welcome everyone to our Instagram Live. Welcome. So we have our trauma therapist, Maryam, here. And I just want to remind everyone that this is Instagram, not therapy. So we both are therapists, and we're really excited to talk to you about the pandemic and trauma and stages of recovery. We're going to use the Judith Herman's model. So the model out of this book, she's a profound trauma therapist. And what we're going to do is apply it to the grief and the uncertainty of our health crisis. I mean, it's been traumatic for many of us. However, before we start, I do want to set some ground rules. So we can't answer any personalized questions or provide therapeutic advice or interventions during this talk. However, at the end, we are going to invite everyone to, if you do have questions, to ask them. So we're super excited to bring this to you. And now with our global pandemic, many of us may have experienced acute stress and have post-traumatic symptoms. And others of us, we may have been triggered from past traumas that we've had because we were globally helpless. We've been confined into our homes, and even the way that we're social distancing, we've really been stripped of a lot of our agency. So now to introduce Maryam here, really it's an honor to have you. I'm so grateful to have you and to have this discussion on this platform. I mean, it's been several years since we went to grad school together. And yeah, I understand that you're a trauma therapist, and I've been seeing some of your work on Instagram. And yeah, maybe you can tell us a bit more of what it is that you do out there in the community.
For sure. Thank you, Jesse. I'm definitely nervous. I have to admit, this is the first time I'm doing a live video talk of any kind. But I'm also thankful for your invite and grateful to be a part of informing and raising awareness about mental health. So hi everyone, my name is Maryam. I'm a registered clinical counselor and a certified EMDR therapist specializing in trauma treatment and recovery. For the past couple of years, I have been working at a nonprofit organization offering psychotherapy to clients who have experienced trauma due to abuse and violence. Earlier this year, in order to diversify my career and to be able to reach a wider population, I joined a clinic in Yaletown called Sina Medical Clinic. And as a clinical counselor, I collaborate with their medical team to support clients' health and overall well-being using a holistic approach to healing. In addition to that, I'm also now an associate at Providence Therapy BC, which is a multidisciplinary counseling and neurofeedback practice, also specializing in trauma recovery and resiliency, with a focus on the mind and body connection. So earlier I mentioned that I'm a certified EMDR therapist, and Jesse, I know you have been practicing EMDR for the past year. Did you want to talk about what EMDR is and maybe tell us a little bit about the work that you do?
Okay, yeah, for sure. So personally, I've been working with the crisis line for 6 years, and I'm in a role of training and mentoring volunteers. And I also support in the clinical decision making when we have emergency situations come through. And I'm also a certified counselor. I work with an EAP company, so that's Employment Assistance Program, for people that have it, and I do that part-time. And like you, I've also just been signed on with a private practice. So I'm working now with Jennifer Michaud and Associates in Langley, BC. And I'm going to be practicing EMDR through that. Yeah, congrats to you too. You're doing so much as well. Yes. So that's where I'm going to have the opportunity to practice EMDR. I've been trained as a basic EMDR therapist, And now I'm going to be getting more supervision to become a fully certified EMDR therapist. So what is this EMDR we keep saying? Well, it's eye movement, desensitization, and reprocessing therapy. So it's a procedure that's used by trained and certified therapists to help us clients and ourselves, if we sit in the client seat, to reduce the impact or the intrusion of past experiences into our present day life. So a trauma, for example, this pandemic has been traumatic for many of us. A trauma may be anything from an assault, abuse, it could be an accident, a natural disaster. There's also emotional traumas. So trauma, there's a huge scope of traumatic experiences that we can go through as human beings. And sometimes this has happened many, many years ago. However, we feel the post-traumatic symptoms such as intrusive memories, emotional flooding, we feel nightmares, anxiety is huge, we get anxiety. And overall, it's just difficult to get on with our lives after traumatic experiences. So what EMDR is, it's a staged intervention, and it begins with the history taking and treatment planning stage. And then there's a huge piece on client preparation. So the therapist doesn't just start doing the eye movements and waving our hands around. We actually, a lot more goes into the assessment and being able to assess whether the client is able to self-soothe. So I believe you're going to talk about our window of tolerance a bit later in this chat. But yeah, so the eye movements themselves, they're done for bilateral stimulation to help us integrate the traumatic experience into our lives. So now to talk about the model that we're taking from Judith Herman here, and we're going to apply it to our current pandemic. So as with any stage theory, we can't expect a linear progression. However, safety and self-care, that's an important first stage. And maybe you can help us out here, Maryam. How can we apply this to what we're experiencing right now, integrating back into society?
So I won't go on tangent, but one thing I want to share with folks before answering this question is a little bit about what trauma is and how it affects our overall well-being. Trauma is basically, and I did write a post about this earlier during the week. So for our viewers who've already read the post, it will be repetitive, but I think it's important in order for us to uncover the stages to have that framework in mind. So trauma is basically something that occurs to us out of the ordinary.
Right.
And it literally affects every aspect of human functioning, from the biological to the social. If an event is unfamiliar in our everyday life, it triggers a sensor in our brain called the amygdala, activating our autonomic nervous system, which leaves us in a constant state of fight, flight, freeze, survival response. In therapy, we use the term window of tolerance to describe the drastic disruption of our nervous system following a traumatic event. So basically, our window of tolerance, aka, is the zone of arousal, which we are able to function most effectively when we are in the window of tolerance. When we're within this zone, we're typically able to readily receive, process, and integrate information, and to also respond to the demands of the everyday life without much difficulty. The brain is functioning well and can effectively process events and situations. When our survival response becomes activated as a result of a traumatic incident or event, the body shuts down as it prepares for emergency. Our normal mind and body tasks related to long-term functioning become impaired. So we can't integrate the traumatic experience and it is left incomplete and interrupted. So when this happens, we say the person is outside the window of tolerance. And during times of extreme stress, people often experience periods of hyper or hypoarousal. Hyperarousal is basically known as the fight or flight response, and is
Right.
often characterized by hypervigilance, feelings of anxiety, and or panic and racing thoughts. Hyperarousal or a freeze response may cause feelings of emotional numbness, emptiness, or paralysis. So in either of these states, we become unable to process our events around us effectively. Most importantly, the prefrontal cortex region of the brain shuts down, which affects our ability to think rationally and to regulate our emotions.
Right.
So now going back to your question, the first stage of trauma recovery, as Judith Herman basically, calls it, is safety and self-care.
Right.
So this is where we use techniques to return to our window of tolerance and to start establishing safety using our self-care strategies. And with the recent pandemic, most of us have been robbed off our power, our sense of power, freedom,
Right.
and control. And with the uncertainty we're experiencing, there's a lot of fear in our responses, and we're basically, reacting with a lot of fear. So establishing safety in this stage begins by focusing on control of the body and gradually moving towards control of the environment.
Okay.
So in that sense, it's useful to keep in mind that we can see self-care into two parts: physical self-care and then mental self-care. And physical self-care is basically having a good sleep hygiene and routine, how we eat, being mindful of eating healthy, exercise, doing things to take care of our physical health, which will really help us be mentally more healthy. And in terms of our emotional health, how we can kind of create that sense of safety emotionally by connecting to loved ones who support us and make us feel safe. And also mindfulness and meditation or connecting to our religious and spiritual practices can really help create that sense of safety because we feel calmer and more in control. Once we understand, the concept of trauma and how it affects and how our window of tolerance is triggered as a result of a traumatic experience, we can really use strategies and small daily steps to build mental resilience and to help navigate this new normal. So I have a couple of steps here that we can implement that could be very useful. One of them is to set a cutoff time for news and social media. This is very important as we're being exposed to a variety of different informations, which is also triggering a lot of fear within us. So while being informed can help us feel more prepared in a public health crisis, setting healthy limits to our media consumption can help us have restorative rest and put the stressful news into perspective. The other step is to focus on the rising and falling of our breath for 10 seconds, to just connect to our natural rhythm of our breath. Pausing several times a day to simply breathe really allows us to feel less tense and more present in our life. The third step is, we're advised to wash our hands now. So when we're washing our hands, to take 20 seconds to, not 20 minutes, 20 seconds, or 30 seconds to think of 3 things we're grateful for. This will really help us lower the risk of the infection as we're keeping our hands clean while reinforcing a more positive mindset at the same time. I mean,
really
we both, and we both have been posting about the benefits of gratitude and
absolutely,
the fourth step is to not judge our emotional responses to this pandemic. To remind ourselves that they're normal and justified. Studies have found that pathologizing our responses by viewing them as that something is wrong with me, for reacting strongly to fear or anxiety, it will actually increase our anxiety. So instead, say something to yourself like, you're going through a crisis and you're reacting in a normal way to an abnormal situation. Lastly, you know, a lot of us are finding ourselves feeling overwhelmed, especially with the reopening stages, as we have to find our ways into, you know, going back to society, and the workforce. We're overwhelmed by how that's going to look like again. So
absolutely,
identifying the smallest possible steps to address this. You know, really breaking it down into small, manageable steps by asking ourselves, what's the smallest step forward that I can take at this moment? This really increases our sense of control and self-efficacy. So these are the steps that will really help during this time to create that sense of safety and to implement self-care strategies.
Oh, these are great. I didn't even think of some of these. So just to reiterate some of what you said is to limit our media access. So maybe limit how long we're going to spend on social media, looking through things about the pandemic or even the news, like you're saying. And then the second step is so simple, but you know, sometimes I even forget that our most powerful tool is our breath. So just to get comfortable and, you know, drop our shoulders down, unclench our jaw, and just take those deep, long breaths to bring ourselves back to this present moment and regain some of that control. So important, easily forgotten. And then the third tip, this one, I hadn't even thought about it, but when we're washing our hands, it takes 20 to 30 seconds to actually think of things we're grateful for in that moment. And recalling 3 things of gratitude can really help shift our mindset into a more positive mindset. So our blessings, as to say. And then I really like this 4th tip that you brought up, is to not judge ourselves. So we might be getting these thoughts of, I'm over this, there's financial stress a lot of us may be feeling, and there might be a lot of other thoughts coming through our minds, like for example, the gas prices went back up now, and that's frustrating. But to actually remind ourselves that we're acting in a normal way to an abnormal situation. Just that self-acceptance, that normalization, which then can help us not pathologize what we're feeling. So yeah, thank you for that one. And then the 5th step is to, somebody just commented, the best thing to do to fight the pandemic is to turn off the TV. I've been doing that too. Yeah, and now to the last step that you were talking about was to break everything down into small, doable steps. So for example, I'm gonna get up and walk my dog and, you know, see my first 3 clients from my couch. That's what I'm doing today. And that's okay. So just to break the day down so we feel like we have more of a sense of control, because in these moments we do have control. Thank you so much. That's a lot of information. I liked how you broke self-care even down into the physical aspects, or nutrition, or movement, the sleeping, and then into our mental self-care or relaxation. Do we meditate? How do we take care of our mind and our emotions? So I really liked how you created clarity around that. Thank you for that as well. Now, to get back to Herman's model, so we have the model here. The second stage here is about grief. It's about remembrance. It's about mourning. So we've all globally, collectively, we've lost the vision of what our March, what our April, and I mean, we're a lot of the way through May here, of what these months were gonna look like. And it's okay to have these emotions, about the grieving emotions of anger, of sadness. And now how do you apply the grief to what we're experiencing here in our pandemic, Maryam? Maybe you could shed some insight, some light to that.
Mhm. So I'm just going to break that second stage to just describe what, kind of we mean by remembrance and mourning.
Right, yeah.
So remembrance is basically telling the story of the trauma completely in depth and in detail. This work is basically reconstructing the trauma and to transform the traumatic experience and to integrate it into our life story, which is a very profound experience once we do that. We're basically, as Judith Herman puts it, we're speaking the unspeakable, because a lot of us are used to avoiding and pushing down events that happens, but through this we can kind of reconstruct that story and make sense of what happened prior to us experiencing this pandemic. So beginning with a review of how our life looked like before this pandemic happened and the circumstances that led up to the event, and how our new life looks like now.
Right.
So in telling the story, Judith Herman says that this trauma story becomes a testimony.
Right.
And there's this healing aspect of, confessing to what has actually happened.
Absolutely, yeah.
So the other part, which is the grief, that the second stage is about, is
the stages of grief.
Well, trauma inevitably brings loss. So and with this pandemic, we mourn everything we have lost. We're feeling a number of different griefs, like we feel the world has changed. We realize things will be different. The loss of normalcy, how our lives looked like before versus how it's starting to look like now. The fear of economic toll, that's a huge one, as a lot of people are experiencing a lot of financial stress.
Yeah.
The loss of connection. We were forced to disconnect to stay safe during this pandemic. And that's a huge loss, because one of our basic needs is connection, is to connect to each other. Exactly. So this has been hitting us, and we're grieving. And we're grieving collectively, and we're not used to this. So to manage all this grief, it will help us to understand the stages of grief. And I'm using Kessler's work. He's famous for grief, grief therapy, and he has stages. So he, again, just like the trauma recovery stages, grief stages don't necessarily go into this order, but I guess with this with our dialogue right now, it would help to put into perspective how we're grieving, or how we may be grieving the recent pandemic. So the first part of grieving is denial. We normally dread and avoid grief.
Right.
So this could look like something like the virus won't affect me. And the next stage is anger. A lot of us are finding ourselves feeling angry because we've lost our choice to do, and our freedom to do a lot of the things that we normally could do.
Absolutely.
We had to disconnect and stay home from our loved ones, and naturally that produces anger.
Right.
The third stage is bargaining. Basically, I can say that this is what I was going through as experiencing this pandemic, saying like, if I stay home for 2 weeks, everything will get better.
Right. And we just had a comment. We just had a comment here. It said our culture doesn't know how to grieve. So thank you for this. Yeah. So I'm glad that you're talking about all of this with us, Maryam.
Yeah. And I love how our viewers are recommending some resources here. Thank you, Sonia.
Okay.
So, and the fourth part of grieving is sadness, not knowing when this will end, and there's really not a deadline with this pandemic. We don't know.
Right.
And lastly, there's acceptance. So kind of reminding
Mm-hmm.
ourselves, once we've moved through the stages that this is happening and I have to figure out how to proceed.
Mm-hmm.
And there's in grieving and going through the stages of grief, we basically reclaim
Mm-hmm.
our power. We reclaim our
Right.
power by taking responsibility for our healing.
Mm-hmm.
And one thing that we should all be mindful of is that there is no set or path for our grieving. We all
Mm-hmm.
grieve differently at different times. So being mindful and respectful of each other's journeys through this pandemic and
Absolutely.
really giving
Uh-huh.
each other space to come to
Yeah.
terms with this new normal, basically,
Mm-hmm.
um,
Mm-hmm.
when
Yeah.
when we feel like we're ready.
Right. Yeah. So a few things you said there really it caught my attention, and thank you again for you know talking about this in such an organized way, but then bringing attention that the stages of grief are going to be different for everyone. We're going to go through things, and we might go from one stage, we're angry, then we think we're gone past the anger into sadness, and then we find ourselves in anger again. So, and that's
Mm-hmm.
all okay. That's all normal.
Yeah.
It's what our bodies and minds and we maybe need to do for ourselves to grieve. So talking about the trauma, when you first talked about the remembrance, is to speak the unspeakable. And I really liked how you phrased that. And then that phrase that you said towards the end there, we reclaim our power by taking responsibility for our healing. And that's
Mm-hmm.
really it. It's about stepping back into our power and finding what we do have control over, and our healing is what we do have control over. And then now going into the third stage, you provided this really nice segue into the third stage of the Judith's model is about respect and empathizing with others. So the last stage here is about reconnection. And this is super applicable. We're physically going to be reconnecting in this pandemic situation, right? So um, with trauma, reconnection is the last um, phase of recovery, of healing. And now as we are heading back into our work sites and into our daily lives, what advice or recommendations can you offer us with that, Maryam?
So yeah, going to the last stage of reconnection, just giving our viewers a bit of, I guess, a concept about, why
Right.
this stage is very important is,
Mm-hmm.
um, helplessness and isolation are the core experiences of psychological trauma. And through
Mm-hmm.
empowerment and reconnection, that's where the core experiences of recovery really
Right.
fall into place.
Mm-hmm.
So basically, in this stage, we have to come to accept the reality of the pandemic and our
Mm-hmm.
losses.
Mm-hmm.
And in doing that, I guess we need to get creative in how that looks like. And the task is really to create a future
Okay.
when we have accepted the reality and to
Mm-hmm.
start to reconnect, because connection is a very important and basic human need. And we lost that
Absolutely.
during this pandemic.
Uh-huh.
Um, and that could be very harmful. So even now, we're being advised to connect, but keep the social distancing
Mm-hmm.
guidelines. So kind of getting creative into to how we can do that.
Right.
Um, it's my niece's 1 year birthday tomorrow, and
Aw.
we're celebrating her birthday, which is a very, very important milestone for me and my entire family, and we're doing
Uh-huh.
that through Zoom. And I know that we're gonna have an amazing time witnessing her turn one
Mm-hmm.
virtually.
Mm-hmm.
Um,
Absolutely.
so I guess one thing that I've realized through witnessing my niece and nephew grow up is how when we were born into this world, we were really born
Mm-hmm.
with a natural sense of curiosity, and we
Mm-hmm.
start to explore the world. And sometimes in our life, as we grow up, we lose
Right.
that. It seems like we lose that. So really connecting back to that curiosity and really being creative and exploring ways of navigating how to make meaning and purpose from the crisis and really create a future that we would love to live.
Yeah. Oh, I really enjoyed how you brought in that example of your niece's first birthday and how you're getting creative and doing it all over Zoom, so you still get to connect. However, it's in a more creative, as you're saying, way. And I think the empathy piece here is huge as well, is realizing that different people are in a different place with all of this. So maybe somebody is in more of a compromised health position and you see them step away far off in the trail or on the sidewalk, and this might create a reaction for you, but to realize, you know, we don't know what other people are going through, what stages of grief they're at, or where they're at with all of it, really. So that empathy piece, as we start to reconnect, is so important. And then the creativity that you're talking about here, Maryam, I think it's really important to check in with our friends and our families about what is it that you feel comfortable with. So now that we're allowed to maybe go to parks and still keep that distance, but have maybe 4 people gathering together, maybe there's somebody that doesn't feel comfortable with that, and that's okay. We can invite them maybe by Zoom or FaceTime or something different and still have that invitation. So checking in with each other, having that empathy and that creativity that you're highlighting. Someone.
And just to add to what you were just saying, and I think I missed that in terms of reconnection. Really, reconnection during this pandemic looks like how we can relate to this changing world. And I wrote a post about this earlier, a couple of weeks ago on Instagram, and kind of reconnecting, but being mindful of everybody's journey again, as I said earlier, empathizing, you know, connecting physically is very important as part of being humans. However, we can also connect with non-verbally, and you know, we can use our non-cues of empathy by smiling, nodding, to acknowledge each other's presence, and to validate and normalize the situation.
Yeah, absolutely. And we just had our viewer here, Sonia, say that they had to have a virtual funeral and how hard that would be. So yeah, our heart goes out to those of you that are experiencing loss on, and it's another layer. Really sorry to hear that. And then I was noting, now that we're wearing the masks, so at the Fraser Health site that I go to, I'm going in person there, and we're wearing masks, and I'm really noticing how a lot of our facial cues are, I use my mouth a lot, I smile, and with half of our face covered, it is another layer of difficulty. Like, how do you let somebody know that you're, you know, do you raise your eyebrows? Do you nod your head extra? So it is something we're collectively navigating. Have you noticed anything with the masks?
Yeah, I have not resumed in-person counseling yet. And I think one of my issues in doing that is that I don't feel like we can really connect to our clients when we're wearing masks. So we're doing that virtually. We're connecting virtually right now, which is very, it's working. It's very helpful. And I'm grateful that we have that access, and people can still access mental health support through virtual ways and telehealth. However, I feel like, you know, as we start to, and me and my team had a meeting yesterday in finding creative ways to come back to the services, to in-person counseling, and we are going to be wearing masks. And so I guess kind of communicating that change to clients earlier on, so they're not shocked, and so they can expect that will be happening. And maybe being creative and showing clients some, you know, nonverbal ways of creating that connection.
I actually saw my therapist this morning, and we didn't wear masks because it was just silly to sit. We were far apart, so we didn't wear masks. But yeah, in places that we do, I feel like so much of our facial expressions is part of our nonverbal communication. So when you're missing half your face, I'm finding it to be a challenge.
Definitely. And we're being recommended to wear masks in public anyways. And again, that's another loss we might experience as we're not getting that connection through facial features and nonverbal
Right.
cues. So I guess it's through recognizing that we're going through different times and safety comes first. Safety is our priority and number one need that needs to be established. And once we take care of that, then we can get creative around the last stage of reconnecting back.
Absolutely. So now shall we turn it to any questions our viewers have? I mean, I really appreciate all the information. You really broke down first trauma and helped us understand the physiological symptoms and everything, and then going into the healing and the model that we used with Herman. I appreciate all of the, you know, the effort and the insight that you put into this with your 3.5 or 4 years of experience in the trauma field. So I'm really grateful to have this discussion with you. And if there's any questions from our viewers here, nothing too specific, as we said previously, we can't give any interventions or therapeutic advice or anything. So does anyone have a question? Well, maybe we can start by asking, how about if we wanted to book a session with you, Maryam? Oh, we have a question. Sonia, why did you get into the field of trauma? Well, I can answer it for myself.
Yeah.
I got into trauma. I've had trauma in my family story. And then as I was in my practicum, I had a lot of clients actually that came with big traumas, and I didn't feel adequate in how to deal with it. So I then went and took the EMDR basic training to give myself more of a model, a better approach with trauma, because I didn't want my clients leaving flooded after the first session. Like, how do I approach this in a calmer, more therapeutic and a trauma-informed way? So that's how I got into working with trauma. How about yourself, Maryam? Did you want to answer that, or we can move
actually,
on?
That's a very interesting question, because trauma was the last thing I wanted to get into as a counselor when I started this. I started my journey into grad school, and what happened is I ended up at the nonprofit organization that I talked to you about earlier. I was doing my internship there, and basically the work we were doing there was offering psychotherapy again to clients who experienced trauma due to abuse and violence. So I started to really get my foundation and my experience as a therapist in the field of trauma. And I just found great love and passion for the work right there, and just continued, basically.
Okay, thank you for sharing that. Yeah, and we had another question earlier. I don't really know. It's my first time on live, so I don't know how to scroll through the questions, but
I think she asked about...
Can you please tell us about ways to give self-love, self-care during these times? I think that's the question that we went through in the beginning, so maybe some people missed it. Did you want to maybe sum that up, or I can?
Yeah, so earlier on in the stages of trauma recovery, we talked about safety and self-care, and we touched on how part of, establishing safety is to use our self-care strategies and creating that sense of safety and control back. So part of that is not judging ourselves and our emotions or our responses to the pandemic, reminding ourselves that they're normal and justified, and not pathologizing them, that there's something wrong if I'm reacting to this pandemic so strongly, because that can increase our anxiety. Instead, really validating ourselves that we're going through a crisis and that we're reacting in a normal way to an abnormal situation.
Yeah, I guess
we'll really create that sense of self-compassion and self-love.
Right. And then the gratitude washing. I mean, this was your idea, but I can sum it up if you've been talking a lot. Yeah, so when we're washing our hands, to whoever asked that question, Maryam came up with this idea is it's going to take 20 to 30 seconds to wash your hands. So why don't we recall 3 things that we have gratitude for, and that really helps change our neural pathways and shift our mindset when we engage in gratitude in our day. So I really love that. So there is another question here. Is there any limit as to how many times one can use mechanisms for getting back to self, i.e. focus breathing? Do you have more information anywhere as to where I can find more coping mechanisms? So for this, I mean, I always tell clients, well, not clients, callers, but to go to Anxiety Canada. So it's a website, it's called Anxiety Canada. It has some stuff about COVID in the beginning, but if you go into it, there's even PDFs, there's a CBT app that you can download if you'd like. There's even videos on there. Anxiety Canada is a great website for coping tools. Do you have one that you really like, Maryam?
I know that there's a government website for those of us living in Canada. It's called Wellness Together Canada.
Okay.
And the government is really offering a lot of mental health resources and support through that website. So that's the one I've been really suggesting to clients. It's a really good one, and we're really lucky to have those resources available. Also, I guess, you know, connecting to us, part of doing therapy is providing resources for clients. So
absolutely,
that's also an option if anybody needed anything specific in terms of
and if you're looking for a therapist, Psychology Today, we're both listed on there. But Psychology Today is great. You can kind of navigate it and you can go through, and it's kind of like shopping for a therapist. It's really neat. I found my therapist there a few years back now because I was looking for somebody who practiced in EMDR, so I could sit in the client seat and actually go through what the clients are going to go through before I started practicing. Yeah, so Psychology Today is another great resource. Do we have any other questions here? We have one that says, hello, everyone. I wonder, how does COVID impact mental disorders? I would really appreciate your opinion. Well, from my experience through the pandemic working, I've really noticed that it's heightened a lot of disorders. So that because the pandemic's been a huge stressor, it's been traumatic. People have maybe offset into psychosis. And I mean, this is going to be different on an individual basis now, but it's really heightened anxiety and depression. And then when it comes to the domestic abuse side, being confined with our abusers, that's another piece that's been really traumatic for a lot of folks, children and adults alike. So I don't know, did you want to speak to this as well, Maryam?
Yeah, just in addition to what you already said, is what we're noticing is that this pandemic is definitely triggering and resurfacing old trauma wounds, and with people who are already going through some mental health issues, it's really impacting that profoundly as well. So again, you know, we went through the stages of recovery and treatment very briefly and just generally. So connecting to mental health professionals really helps during this time as a way of finding that space where you can feel safe and exploring ways to take care of yourself and the symptoms you might be experiencing as a result.
I know, and then if it is really overwhelming to even connect, I mean, the crisis lines, there's the 310 mental health line that's available all over BC. So you can just Google it, it's 310 mental health. There's 1-800-SUICIDE. So if you're having depressive thoughts, you know, you're having thoughts of harming yourself, that line is available all over BC. Again, 1-800-SUICIDE is the line. And then there's the Fraser Health Crisis Line. There's the Vancouver Coastal Health Crisis Line. And they're trained there to connect you with resources in the community. And a lot of people also aren't aware of their benefits. So check your benefits package. You may have EAP benefits, and that might be a short goal-oriented type therapy. However, it might address some things that are coming up for you now. And then if you need some longer term services, that therapist would be able to connect you as well. And I mean, if you do have the finances and you're interested in getting therapy and their psychology today, like we've mentioned. Is there any other questions that you're seeing here? No. Okay, well, yeah. Well, again, I'm really grateful that you were willing to have this dialogue, and we are so grateful to the people that tuned in and listened. So we will save it if you want to go back and listen to the ideas we had for self-care through this. Maryam had the tips that she brought up, and then if you want to hear the whole thing over again or any parts of it, we'll upload it to our highlights and maybe our IGTV.
Yeah, and I guess before we end here, because there might be some viewers who have pressing thoughts in the back of their minds who just don't feel comfortable to share. So can you tell us about how they can find you, for example, if they needed support?
Okay, yeah, so I'm available. My link's in my bio if you want to book with me. So that's if you're not a friend or family member that's tuned in. So yeah, you can book with me. And I'm working with Jennifer Michaud and Associates now, so I'm offering private counseling. And how about yourself, Maryam? If somebody wants to book with you, what does that process look like?
Yeah, I guess the easiest way is, again, I have my contact linked in my Instagram page, so you can find me through my email, website, and I believe my phone number is there, but the easiest way is to contact me through my email, which is linked there. And Psychology Today is also another great platform.
Yes, we're both on Psychology Today.
Yeah.
Okay. All right. Well, we really appreciate everybody that listened and came out, and I hope everyone's taking care of themselves through this uncertain time. And let's all try to be empathetic as we reconnect. Okay.
Thank you so much for having me, Jessie. And yeah, I just wanted to thank our viewers as well. Definitely, you know, being here with us today is your part in advocating for mental health during this time.
Absolutely. Yes. So just by being here, you're advocating. Thank you to all of our viewers. So much gratitude. Okay.
Take care.
Okay. Bye, everyone.